On today's episode at Nurse Clement B, I am going to show you a few things that you can do during OSCE, tips that you can use during VIVA, during OSCE, right? VIVA, do not forget that it's VIVA. And during VIVA, you are being asked on instruments, organs, and other things that the examiner can place his or her hands. So the first thing that you will do as a student nurse, student midwife, if you are asked or the examiner place instruments or items, be it drugs, whatever it is, the first thing you will do, most especially if the things are having label like this, right? So the first thing you would do is that as a student nurse, you pick this. Do not rush. Read. Place this at eye level. Read it. Nobody will crucify you and nobody will say, why are you wasting time? So the first thing you will do when you place it at eye level this way, then you read what the manufacturer places here or what is being written on the container or the carton of or the coverage of that instrument, right? So now, for example, this is what, as you can see, mucus extractor. So while identifying it, you will tell your examiner that this is called mucus extractor. It is a sterile, non-polygenic. Read it. So don't read it from your head because the examiner has read it before he places it on the table, right? So, and it is what? Size 8, as you can see. Yes. And they may ask you, can you tell me the storage of this particular item? It is also written here. So as a student nurse or student midwife, also read it. The storage is that you should not store this thing on at a high extreme temperature. So it is not being autoclaved because there is tendency that it will melt, right? So, and also the examiner may ask you, how do you dispose it? Then you tell the examiner, do not you dispose it inside a bin, right? And then do not re-sterilize or use it. It's a single-use instrument, right? A single-use apparatus. So as you can see, everything that the examiner has been asking me is written on the label, right? So what is the function? It is called mucus extractor. As the name implies, it is being used to extract mucus from the newborn baby, right? So, for example, it is mucus extractor. For example, you have the newborn on your table this way, right? And then you connect this end to the suctioning machine. You connect this end to suctioning machine while you use this tip and insert it into the baby's nostril or the baby's mouth, right? And then you suction every secretion that is coming out of the patient's coming out of the baby's nostrils or the baby's mouth. So this is what we call mucus extractor. So its function is to remove mucus from the patient's baby's newborn nostrils and mouth. During examination, they may place this also. Don't just jump and say it's a catheter. No, please can you kindly, the examiner wants to know whether you have the ability to read and identify things like medication, whether you can be able to know the right medication you want to administer to your patient. Please can you kindly turn it this way? What is identify, for example, identify the instrument before you or the item before you. Then you turn it and put it at eye level and said, this is what? A Foley balloon catheter, boldly written. Latex, 100% silicone coated, as you can see. Then the examiner will say what size it is. Remember, look at the size here. And the size is being written here. It is a two-way catheter. Right? It is a two-way catheter, 16, and you can inflate the balloon here. You can inflate the balloon here with what? 30 mils of distilled water, boldly written, right? And you can check the expiration, the manufacturing date, and the expiration date, boldly written. So whatever that the examiner wants to ask you, it's almost half gone where you gone with this that is written on the label. So the examiner can decide to ask you, can you demonstrate the usage of this? Then you explain, right? During VIVA, maybe the item may be this. So this is what we call what? Umbilical cord clamp. Umbilical cord clamp, right? As you can see, boldly written on it, umbilical cord clamp. And it is being used to what? Clamp the cord of the umbilical cord of a newborn. For a function is for clamping a newborn umbilical cord, right? So for example, we have a newborn with an umbilical like this, then you place it over, right? Maybe you have cut to the length that you want, or just like this. As you can see, you press this, right? You press this and push it into this space that we are having. So you push this end into this space, right? So you press it. You don't have to like struggle. You press it, make sure it's closed. As you can see, it's closing. Like, then you press it and it opens, and it keeps the umbilical this way tight so that the baby will not bleed through the umbilical cord. So this is the function of this umbilical cord, just to clamp the umbilical cord of the newborn. Thank you for staying with me till the end of this video. I hope this video is helpful. Thank you for your support. Thank you for your shares and your like. Bye bye.